let's begin the next one. So we have got Morton's metatarsalgia. Metatarsalgia or Morton's metatarsalgia, right? Or Morton's neuroma. Right. So what patient is saying? Patient is in the GP. Our patient is 35, has come to you with the complaint of pain in her right foot, pain in the right foot. Talk to the patient, assess the patient, and address her concern. Mostly you'll have a female patient when we are dealing with Morton's neuroma, right? So, GP 35 female complaining of pain, right? So what we have to do here when you start the station, how can I help you? I've got pain in my feet. Fine. So what do you do when pain is there? So don't go with which foot straight away. So what you do Socrates straight away. Socrates. Yeah. Elaborate this pain, right? So I've got pain in my feet. So tell me more about your pain, right? Then you need to know like which foot, like is it right or left? What kind of pain it is, if it is going anywhere, if anything makes it worse, anything makes it better. So all those things you're going to ask. So what you did full Socrates and then asking for the scoring as well, right? And if the patient has tried something before to relieve this pain or not. Because if the patient is going to score it, at least I'll get a bit of idea, isn't it? Like in terms of painkiller, which painkiller I should be prescribing? Should I go with the higher painkiller or should I just give normal painkiller? So that is really, really important here, right? And then anything else? Once you're done with the elaboration of presenting complaint, the next question that you will have is anything else, right? So nothing else, doctor. Now what you can ask some other questions as well, just to see like if patient has got any numbness, tingling, right? Because that is specifically for Morton's neuroma. Right. So Morton's neuroma, Morton metatarsalgia usually happens where it's on the second or third or between third and fourth toes. Let me show you a picture that will make life easy for you. So Morton's neuroma. So here you will have the pain usually. Second or third or fourth toes. So this is the particular area where you will have the pain. Why this happened? Because of the shape of your leg like this. So why my feet is like that? Why my foot is like that? Because the patient is wearing high heels. So you will see it is more common in women, corporate women, those who have to wear the heels and all. So that's why you will see the pressure is going to be there in the toes area between second, third or fourth. So this area pain is going to be there. And that can actually lead to this Morton's neuroma. All right. So what we're going to do, I have pain. I'm going to do the elaboration Socrates, and this patient is telling us that it gets worse. This patient is saying when I'm wearing the heels, it is very bad at that time. But my work, I'm working in a corporate office, so I need to wear heels as well. So that's making my life really, really difficult. Okay. Now there are some risk factors as well. Risk factors is what I said is wearing a tight, pointy, high heel shoes. That's one thing. If you're doing excessive running or if you have got flat feet, high arch feet, bunions or hammer toes, or if you are overweight, that is really, really important. So overweight, so that's what I'm gonna do. I'm gonna do a very quick past medical history as well. And when it comes to examination, I will definitely mention about BMI as well, right? Okay, so pain, what you're gonna do, you're gonna elaborate pain, Socrates, anything else? No, doctor. Then I'm gonna ask if there is any numbness, tingling. If there is numbness, tingling, it's gonna go more towards Morton's neuroma. That is the main thing. Okay, so see, what is Morton's neuroma and what is metatarsalgia? Metatarsalgia, I would say it's an umbrella term. Let's read it. Metatarsalgia, it's a general name given to the pain in the front part of your foot under the head of your metatarsal. Morton's neuroma is a possible cause of metatarsalgia. So metatarsalgia is a big umbrella term. Morton's neuroma is a part of it. So that is why when you have a case of Morton's neuroma, mostly you will see doctors, we say it is Morton's metatarsalgia. So the name that we give is Morton's metatarsalgia. So when you elaborate it, when you give the diagnosis, you can give the diagnosis of Morton's metatarsalgia as well. So if the patient is just having pain, not having this numbness, tingling, it is just simply metatarsalgia. But if patient is giving you the numbness, tingling as well, then you can say this is Morton's metatarsalgia, right? And also you'll be able to feel the lump under the feet feeling and swelling, redness, hotness that I'm going to ask. Please ask for some differential like septic joint. So just ask for any fever as well. That is really important, right? Please cover these risk factors because patient is going to ask you in the later part of the station, why I'm having this problem. So you have to have something to blame, isn't it? So that's what you do. Then go for quick past personal lifestyle history as well. That's very important. Psychosocial, why it's important? Because what is the job occupation of this patient? Because one of the risk factor is wearing tight point heels, right? Another PMHs, so ask about this if patient has got any past medical history, which can lead to obesity and all. So that's really important as well, right? Then I would like to do general physical examination, vitals, BMI, as I said, you need to mention, and the examination of the feet. And I would like to do some routine blood investigation and maybe the X-ray of the feet as well, right? And then accordingly, you'll be able to give the diagnosis. All right, so we are suspecting you may have Morton's metatarsalgia. It is a thickening of the tissue around the nerve in your feet that has been irritated, and that's why we may have pain in this particular area. That is it. All right. Now, what's the treatment? Treatment is very easy. Treatment is simply you do price. Yeah, we know that ankle sprain treatments, the same thing you have to do here as well. So painkiller, that is one thing, right? So rest, that is important. Ice pack, yes. Compression, yes. And keep your feet elevated. So that is the treatment. Price. So conservative treatment, so you can avoid wearing these heels as well. So it's better if you wear wide shoes, low heel. That is the main thing. And in the market, on the Boots pharmacy, you'll be able to find some pads as well, metatarsal pads, which is, so for example, if you have got flat feet, so if you wear these metatarsal pads, you will see it is much better and you won't have the pain, right? Pain management, obviously, and surgical options. I don't want you to give surgical options straight away, but yes, if it is severe pain and all, we might be going for this as well. But I don't want you to mention, because first thing that you're going to mention is the conservative treatment, obviously. All right. So that is the main thing. So that is your treatment. Price is your treatment here. All right. Okay. So, and it usually happens, as I said, in second to third or between third to fourth dose. Right. Now we have got another scenario here is a plantar fasciitis. Have a read to this. You are FY2 in GP surgery. Patient is a female patient, 48, and came with the pain in the heel. Talk to the patient, address her concern. Right. So pain in my feet. So what I'm going to do, I'm going to do my Socrates. Let's see. Let's do the full Socrates first. See the character of the pain, what makes it better, what makes it worse, right? So all those things I need to know. Patient said mostly it is in the heel area. Okay, when I take my first step in the morning, this thing, especially when I take first step in the morning, this is a clincher for you. So you are sleeping, you woke up, and when you put your feet on the ground, you started having the pain. That is classical history for plantar fasciitis. Okay, so what we are doing, if you do a proper Socrates, you will have your diagnosis with you. What is plantar fasciitis? See, this is the inflammation of this fascia, inflammation of this ligament, this band. So this band, if you see, it is connecting your calcaneum, your heel to the toes, right? If there is inflammation of this band, this is what we say plantar fasciitis. Usually why it happens? Because of flat feet. That is one of the main reasons. So if you put this picture in your mind, I think you'll understand what plantar fasciitis is. So we have got a ligament, ligament which connects your heel to the toes. When there is inflammation of this ligament, it is going to lead to plantar fasciitis. Right, that's the main thing. Risk factors, obviously increased physical activity if you are doing. Flat feet, this is one of the main reason for this, right? Obviously obesity and flat shoes if you are wearing, so that can lead to this plantar fasciitis, especially when I take first step in the morning. That's your clincher. That is what patient is going to tell you, right? So whenever you get any station in your exam, you simply have to elaborate the presenting complaint. And I promise you, like, mostly you'll have the diagnosis with you. 90% of the times you'll have your diagnosis with you. I'll ask some more questions like any numbness, any tingling, any redness, any bruising, any fever, flu-like symptoms, any redness, hotness in that area. I'll just do that associated symptom history as well. Okay, then go for quick past personal history as well. Why? Because obesity and all, you need to definitely work on to that. So general physical examination, vitals, mention about BMI and the feet examination as well. Then you can give your diagnosis, that plantar fasciitis, which is the inflammation of the thick band of tissue that runs across the bottom of your feet that connects your heel bone to the toes. That's it. That's it. So it is a band of tissue which connects your heel to the toes. When it gets inflamed, it can give you this pain. That is what we call plantar fasciitis. As simple as that. Right. What's the treatment? Treatment is again the same. So you have to have painkiller, you have to have rest as well. You can use ice as well, and elevation. You can mention that as well, right? And same thing here. We have got like tell the patient. I mean, the flat feet is there, right? So what we can do here? They can wear some comfortable pads, right? The orthotics like arth support that you can get from the Boots Pharmacy, as I said. So that will be quite helpful in the management of plantar fasciitis as well, right? Have a look at this picture. I think that will make your life easy, right? So plantar fasciitis is the inflammation of this fascia, and pain is going to be in this area, right? Whereas when we get Morton's neuroma, pain is going to be in this area, at the back actually, on the heel, on the second, third, or third, fourth metatarsal. So there is the pain. Why? Because of heel. Patient is getting high heel, pointed heels, and that's the main reason. All right. So that is what we have got in Morton's metatarsalgia and plantar fasciitis. All right.